It is cold and flu season, and with the COVID spikes happening, it is important even more to get the vitamins you need. So today we turn to Southwest Wellness Group and see what the benefits of having an IV vitamin infusion is. And so, hello, doctor. How are you?
Good. Thank you for having me.
All right. You were here last time. We talked about some of the things that the Southwest Wellness does for you. And one is the IVs that are very important, especially right now. And I think people are trying to weigh out going, okay, do I just go get the flu shot and I'm good? Or do I do IVs? Both are very important. But what's the benefit of having the IV?
Okay. And we would, first of all, we would always suggest you get the flu shot. The only reason not to get it is that the baby's under 6 months old, severe chronic disease, you have an allergy to eggs, or some other severe condition like Guillain-Barré. Otherwise, please get it because it provides herd immunity for all of us.
Yeah.
In terms of the vitamin infusions, we love it because what it actually does, it actually boosts your immunity and it allows you to have better protection, we believe, against COVID. Some of the newest research has shown that if you are low on vitamin D or zinc, you're going to have a more severe infection or higher risk of death if you go into the hospital. So by increasing your vitamin levels and getting vitamin infusions, we believe will help. We do think you can do the same thing through your diet, but if you are deficient and you want to improve it, we can help.
Yeah, and we're seeing me getting one right here when I came out to you about a month ago is when I had my first one, actually.
Yes.
It was really nice with you guys. You guys really take care of it. And what's very important, like you said, is that I'm getting the fluids into me too that we forget about, especially in wintertime. We think, okay, it's cold out. I don't need to have that water like in the summertime, but this is very important too, right?
Absolutely. So good hydration, that's always very, very important. One of the things that we find that most people lack is that they have low levels of vitamin D. And also remember that in people who, as the shade of your skin darkens, you have more melanin. More melanin is actually a skin blocker that actually prevents vitamin D from being converted. And so people with a darker skin are going to have more deficiency in vitamin D. The lower your vitamin D, the higher your the risk you have to having a severe COVID infection.
Wow.
So if you can increase your vitamin D levels, the research is saying that you're going to have a less severe round of infection if you happen to get infected with COVID.
Wow. I knew about the vitamin D, but I forgot like the dark skin does that a little bit. Okay. How many infusions should you have? Like a month or in the week, or how's it go?
And so we basically tailor it to the person. How do they feel? So we'd probably recommend starting out with a couple, 3 to 5, but we would base the infusions on the person. How do you feel? And also, if they are concerned about vitamin D, we would actually check a blood level for that, and then we would provide vitamin D supplementation based on your deficiency. Okay. But the others are based on just what you can tolerate, how you feel, and how often you'd like to have it.
Yeah, and that is for someone like me who's fitness and doing different things. But one thing you do at Southwest Wellness is that you do take care of people who have addictions, and sometimes the IV is something that is really helpful for them because they are lacking that through their addiction, aren't they?
Thank you so much for bringing it up. So most patients who are going to suffer from addiction are going to have a vitamin C and D deficiency, and patients who drink alcohol, they're going to have a severe zinc and magnesium deficiency as well. So we know that these patients are going to suffer from vitamin deficiencies, and if they happen to get COVID, it can be extremely severe for them. So providing infusions, therapy, and in boosting them up, preparing them for this winter season could be immensely important for them.
Yeah, and we're taking a look at, of course, the Southwest Wellness Group area. And again, you're a full-fledged service there to help people, especially at this time as we're moving into the holiday season. Depression's going to come about, the election stuff. So you're saying, please give a call. Your team's ready to go to help people and talk with them.
Absolutely. One of the things I always ask each and every patient is check on your family, check on somebody every day, because a lot of people like to say the cure is worse than the disease, but also I think we just need to remember to be interconnected. And as we connect with people, we can reduce the amount of alcoholism, suicides, overdoses, and other things that would occur if we leave people in isolation.
Yeah. Dr. Ray, thanks for coming by.
Thanks for having me.
Thank you very much. We got the information on aztv.com for you to find out more about the Southwest Wellness Center and, again, the infusions, what I do recommend, especially with the COVID.